All right. Friday night live video, and we are talking all about diabetes. So I'm super excited about this subject. I get really geeked on it, and to explain why I get so excited about it, I'm going to tell you a little bit about my background. So my name is Lindsay Scheel, and I went to school to be a cardiac surgeon. I went to medical school, and I was an MD PhD student in medical school. So what that means is that you do research for the university and they pay for your medical school. So I was on a full ride scholarship, and guess what I did my PhD work in, y'all? Insulin resistance. So that's what we're going to be talking about tonight, is diabetes and insulin resistance. And we're going to talk about both types 1 and type 2 and sort of some alternative therapies to help you if you're suffering from that. Now, here's my disclaimer. I'm a medical school dropout, okay? I walked away from Western medicine totally in 2006, so I am not a practicing physician, and I am not here to diagnose or make some kind of claims that I can cure you. This is more meant for just education. So with that being said, let's jump into this. Now, if I were to ask you, what is insulin's role in your body? I want you just to think about that for a minute. What is insulin's role in your body? The role of insulin, if we're really going to break it down, okay, is to accumulate fat. It is to accumulate body fat. And that really goes back evolutionarily to the caveman days. When it got super cold outside, they started eating a lot more, right? And what that did was it helped insulin pack on some brown adipose tissue. And what that did was brown adipose tissue is what generates body heat. It protects your organs. It keeps you, it regulates body temperature. And so really that is insulin's role. So I want you to think of insulin as a school bus. Okay, and so insulin's going to go around and it's looking for glucose to pick up. And insulin will gather up your glucose, and it's going to take it and it's going to store it as glycogen. And glycogen stores are found in your muscles and in your liver. All right, so when you think about big bodybuilders and people with a lot of muscle, they can eat 4 pizzas on a Friday night. Right? Why? Because all of that carbohydrate, which is broken down into glucose, is going to go into their muscle tissue, and their muscle tissue is going to burn through it quick, right? That's where the glycogen stores are. But what happens in a lot of people, we'll call them normal, if you're not this huge, bulky, what happens when your glycogen stores get full? Well, insulin will then convert that excess glucose into fat, all right? And here begins our story with diabetes. So, whenever you're eating a ton of carbohydrates or a lot of sugar, all right, over time what happens is those insulin receptors in your body become resistant. And so this leads to a condition called hyperinsulinemia, which means your insulin levels are going to be really high. And this is what's going to begin our cascade mechanism that is very typical in type 2 diabetes. And so that's where we're going to start. We're going to talk about type 1 in a little bit, but we're starting with type 2. So a lot of people with type 2 diabetes have what we call a metabolic syndrome, all right? And we're also going to talk about what that is. Metabolic syndrome is you have to have basically 3 out of 5 of the following symptoms, all right? You either have to have abdominal obesity, high blood pressure, high blood sugar. You're going to have high triglycerides and high LDL, which is the bad cholesterol. So if you have 3 out of 5 of those, you are what is considered, you have metabolic syndrome. And metabolic syndrome and type 2 diabetes go hand in hand. And diabetes and cardiac disease go hand in hand. And I'm going to explain to you why. All right, so what happens is you're eating a ton, there's all this excess glucose, right? And so it leads to insulin resistance and then hyperinsulinemia. And so in these people that have so much insulin, then inevitably what happens is the blood sugar drops, okay? And so I want you to think about the quintessential type 2 diabetic. Typically they are overweight, they have no energy, they're tired all the time. They've got brain fog. Typically, they will have those other issues that we just talked about, high blood pressure, they've got high cholesterol, all of those things. And a lot of times they're depressed and they have very poor mental function, okay? These people a lot of times will go and get on antidepressants. They will. And a lot of antidepressant medications and anti-anxiety medications, basically any kind of psychotropic drug, chronic steroids, or synthetic hormones. So women, I want you to think about birth control. If you were on synthetic estrogen, synthetic progesterone, I hope your ears are perking up. All of these things can also cause insulin resistance. So if you're already type 2 diabetic, plus you're on all these other drugs, think about what you're doing to your body, all right? So the first thing I want to say is if you're on hormones, you better make sure you are on bioidentical hormones, bioidentical. And I promise you there's a jillion doctors out there that are doing it. If you were on synthetic hormones of any kind, you need to get off. Number one, synthetic estrogen is the leading cause of breast cancer in women. It's also the leading cause of heart disease. Conversely, bioidentical estrogen is cardioprotective. It also helps prevent uterine and breast cancers. All right, so bioidentical hormones. All right, back to what happens in insulin resistance. Okay, so sorry, I have like a ton of notes and I wanted to make sure I get all this. All right. So if you're insulin resistant, you basically become a fat producing machine. And so think about it. If you are a type 2 diabetic and you eat a cracker, what happens? You send your insulin levels go through the roof. All right. And so you eat this one cracker and insulin goes and jumps all over it, and then it plummets your blood sugar levels. So you go from hyperglycemic to hypoglycemic, hyperglycemic, hypoglycemic. That's what happens in type 2 diabetes. Now here's the great news. Type 2 diabetes is reversible. It is reversible. You can change it. And we're going to talk about what to start doing that. So when your body has all this extra insulin and it's not using it properly, you become a fat producing machine. And this is why diabetes, type 2 diabetes is so linked to heart disease, because all this, so remember what I told you insulin does. Insulin's job is to take all that excess glucose, and because your glycogen stores are full, it's now going to start converting it into fat, specifically triglycerides. So what happens is now you're going to start producing all these atherosclerotic plaques. That means those are plaques, that is fat buildup on your blood vessels. Why do you think diabetics have so much problems with their kidney and their liver and their eyes? It's because their vascular health is going to start going down very, very quick, because they literally have fatty plaques building up all throughout their body. So type 2 diabetics, you're going to start having liver issues, kidney issues. Their blood circulation starts getting very, very poor. There's something called diabetic neuropathy. I can pick out a type 2 diabetic pretty easily, especially if they're wearing flip-flops or sandals. Why? Because the bottoms of their legs will have like a reddish, purplish color. Typically their nails are real funky looking. A lot of people will think it's fungus, and sometimes there is fungus there, but their nails will be yellowed and kind of gnarly, for lack of a better term, and they will often have sores down there. And in diabetic neuropathy, they can't feel it. So they've literally got like nerve damage, nerve numbing, and it's because the blood circulation is so poor. And this can be very, very dangerous, because diabetics that go for a long time chronically uncontrolled, a lot of times end up getting their legs amputated. It's very, very sad. So a lot of them will end up on dialysis. So this is something that, again, you want to get a hold of, and you want to start making changes. So how do you do that? I hope right now that everybody, I literally want you to write this down. Hormones are stronger than diet. I want you to write that down. Hormones are stronger than diet. When you have this metabolic syndrome, your hormones are out of whack. And so the first thing you need to do is you need to go to a doctor who's doing bioidentical hormones, and you need to get your thyroid checked, and you need to get women and men, we're going to talk about testosterone, all right? Women need testosterone. And a lot of times in probably about the mid-30s, women's hormones start going crazy. And I don't know what it is about that mid-30s, but they do. And so women should be in like the 100 to 150 range of testosterone. Men are typically 1,000 to 1,500. So, but women, we do need testosterone. And what testosterone does in a woman is it helps clear the brain fog. It's going to help you retain muscle mass. It gives you elevated mood. It's just, if you have aches and pains, it will help take that away. And so the one thing I'm going to tell you as we're talking about this is you do need to go get your hormones checked, okay? Because hormones supersede diet. The other thing, and it's becoming more and more popular, and you hear about it all the time, is a ketogenic diet. So a ketogenic diet, let me tell you what happens. The body is so used to burning glucose, right? Because especially in a Western American diet, we're eating a ton of glucose. We're eating a lot of carbs. But when you switch that to a low carb diet, where you are eating high protein and the good fats like coconut oil, avocado, grass-fed butter, all of those things. If you lower your carbohydrate enough, and there are little strips that you can buy that you can test your urine and actually see if you're in ketosis, then what happens is the body within 48 hours has to switch its fuel source for burning. So it'll burn through all your glucose first, then it's going to use up your glycogen stores, but then the body is going to switch to your own fat stores to burn, and this produces ketones. Now, Dr. Atkins was he was a cardiologist at the Mayo Clinic, brilliant physician, and he's really the one that pioneered this. And originally, guys, people thought he was nuts. I mean, he was kind of like turned against in the medical world, because people thought, you can't eat bacon and eggs. If you eat fat, that's what's causing the fat. And he argued, he said, no, insulin is what is accumulating fat. So it's not the bacon and eggs that's hurting you, it's the biscuits and the gravy, and it's the rice and the beans, right? And so he really pioneered this way of thinking, and now it's super popular. But when your body switches to ketones, here's the thing. Your brain and your heart actually prefer ketones as its preferred source of fuel. So when you do this, you start burning your body's own fat stores. And so that's the other thing that I'm really going to recommend. And one of the things that you'll notice is that people that are typically overweight, really, and I'm being serious, if you watch them, they're usually not eating a lot. Actually, if you watch someone that's overweight, they typically eat less than someone who's super skinny and works out all the time. And so what happens is, because it's, again, like they eat that one little cracker, their insulin levels are so jacked up because of the excess glucose that it affects everything. It affects their thyroid, it affects their adrenals. And so there's a lot of stuff that goes on there. So our company has some really great products that can help with type 2 diabetes. And so here's what I'm going to tell you. We have something called the Core 4. And the Core 4 consists of a cleanse, which is the only product I know of currently on the world market that is going to detox all 7 pathways. So it's going to affect your liver, your kidneys, your lungs, your blood, lymphatics, skin, and your bowels. And what's really important is, I hope you heard me say liver. Because the liver, as a detox, it gets backed up pretty quick. And so with someone that has metabolic syndrome, you want to be detoxifying that liver. So the cleanse is huge. The second product we have in our Core 4 is called Goyin, and Goyin is full of adaptogenic herbs, and an adaptogen, by definition, will up or down regulate hormones according to the individual's need. So I want you to think about that, because when we talk about hormones, a lot of times people think, oh yeah, estrogen, progesterone, testosterone, but guess what? A hormone, by definition, is a chemical messenger. So we've got hundreds of hormones, insulin being one of them, cortisol, your adrenals, your thyroid, all of these things. So you can imagine, based on everything we've talked about, that Goyin is going to dramatically help start regulating your hormones. Third product we have is our Daily Build. It's a very comprehensive multivitamin, and just that in and of itself will flood your body with nutrients, and it's going to help with cravings. So someone that's struggling to lose weight, and maybe they're either pre-diabetic or they've got type 2 diabetes, when you take that Daily Build vitamin and you start getting the proper nutrients, you're going to see your cravings and your appetite go down. For instance, if I'm a chocoholic, I crave chocolate. You know why? Because I have an ongoing magnesium deficiency. And unless I am taking a lot of extra magnesium, I crave chocolate. And I always know when that's coming on. So things like that. So you'll be amazed at how that's going to decrease your appetite just naturally, and also take away some of the cravings. The other thing we have in our Core 4 is a product called Energy. It's one of my favorite. It should be called Focus. But it is full of lots of amino acids, blue-green algae, things that are going to alkalinize your body. And that alkalinity is very important when it comes to diabetes, because the more alkaline your body is, it starts bringing things into balance so that all of your normal functions, the way your body was designed to be, will begin coming into line, and you're going to start seeing very positive manifestations of that. Something else that our company has, and please, if you are overweight, and maybe you've been dieting, you're exercising, you're doing all this cardio, and that weight will not come off. It will not come off. I'm telling you, your issue is hormones, okay? So go get them checked, but you need a metabolic reset. And how you do that is we have a phenomenal detox program. And guys, if you're watching this, we have a whole other detox Facebook group. If you'll get with the person that invited you to watch this right now, we have a whole other detox group, and we have a pack that comes with everything you need. And I am telling you, whether you do the 7-day detox or you do the 28, it is going to radically, this is what gets you that metabolic reset. So you want to check into our detox program. All right, now, remember how I told you that Dr. Atkins was kind of shunned in the beginning and people were like, you're crazy. And they really did not buy into what he was teaching. And they were like, you can't be in ketosis. That's dangerous. And really they were mistaken, because what they were doing was they were confusing ketosis with something called ketoacidosis. And ketoacidosis is life-threatening, and it's something that you typically see in type 1 diabetics. So this is where we're going to segue and go back into to type 1. In ketosis, you have very low blood glucose in your body. You've got high ketones, right? Because your body's breaking down fat. In ketoacidosis, you have both high glucose and high ketones. Because in type 1 diabetes, there's no insulin. None. Now in type 2, remember I told you got insulin, but just your receptors are overworked. You've got insulin resistance. But in type 1, there's no insulin. And so that combination of high glucose, high ketones, that causes a life-threatening condition called ketoacidosis. And yes, that is, again, it goes back to alkalinity, right? Your blood pH has to be at a 7.4, which is a slightly alkaline pH. When you go into ketoacidosis, it's rapid. Your blood goes acidic, and it can be hours before you pass away. It immediately starts shutting down the kidneys, immediately starts shutting down the liver. And so that ketoacidosis is really what people were thinking of, and that's why they were like, oh, you can't be in ketosis, that's bad, that's bad. We know that that's not true, and they're two completely different things. So now let's go back and let's talk about type 1 diabetic. We've been talking about autoimmune disorders, and in type 1, it is considered an autoimmune disorder. It typically starts in childhood right off the bat, and for some reason, we don't totally know, but the body attacks itself. The body begins attacking its insulin producing cells in the pancreas. And so type 1 diabetics are insulin dependent, and they're always gonna be, all right? As far as current right now. Now, I am gonna be posting 2 studies, and I'll briefly talk about them. There is some science where they're looking at some ways that hopefully type 1s maybe won't have to be insulin dependent, that maybe they can trigger the body to start producing insulin again. It's being done in mice right now, so we're a good ways out, but they are very fascinating studies, and I'll make sure and post those here. But so I just want to make sure that our goal is not to say, oh, you're a type 1 diabetic, we're going to get you off insulin. No, you're going to stay on insulin. But here's what I want to tell you. Diabetes is a progressive disease. It is progressive. So if you are a type 1 diabetic, okay, it is going to progress unless you can begin healing the body. Because why is the body attacking itself? We don't know, but for some reason it is. So again, when you flood your body with nutrients, it is going to begin to balance itself. And the hope is in a type 1 diabetic that you can hold up from continuing increasing the insulin dosage that you require. So again, type 1 diabetics, diabetes, guys, is a very serious disease. You definitely want to be under the care of a physician. But so the same products that I named for type 2 are actually going to work for type 1 too. There's a couple of other products that I totally forgot to mention, and I've got one of them here. Sorry, I'm kind of vacillating back and forth between type 1 and type 2. Sleep. Sleep is so important, okay? And so we have this product. It's now called Sleep Trim. This says Mellatrim. They just changed the name to Sleep Trim. But it has melatonin, and it has something called capsaicin, which is a black pepper extract. But what's great about this is it's going to help you sleep, especially in type 2 diabetes. I am switching back. Lack of sleep increases cortisol production. So let's talk about the role of cortisol in the body, right? When your blood sugar drops down, the body kind of goes into that fight or flight, like, oh my gosh, what are we gonna do? And so it increases, your adrenals produce cortisol. Cortisol's role is it stimulates glucose production, right? So can you imagine, like when your body's getting tired, everybody think about this. Like this happens in babies, like, when they're not sleeping, right? So they're getting tired, you're getting tired, but you don't go to sleep. So all of a sudden the body says, all right, we're not going to go to bed. I got to kick it up in gear because we're going to keep going. So that's what cortisol does. Cortisol shoots up. It's actually a stress hormone. It's also produced in response to stress, but it's like, all right, here we go. Let's go, baby. Woo, woo, woo. And then you stay up. Okay, so there are studies out there that if you're not in bed before 9 p.m., your cortisol production goes way up. So I am a night owl. I stay up till 2 o'clock most mornings, and I recognize this is something that I want to change. So listen, I'm a little bit of a hypocrite in what I'm telling you. I want to change this, but I am up very late. Anyway, so cortisol levels shoot up. Cortisol, again, packs on belly fat because it's stimulating all this glucose. And where is that glucose going to go? Well, it packs on as belly fat. You can pick out a woman that has high cortisol. You know how? They're like the round, peachy, orange body shapes. They've got big old belly, and a lot of times it will lead to something called Cushing syndrome, and they'll have like this humpback, like this accumulation of like fat on their back. And Cushing syndrome is like a whole nother thing. The other thing that happens is adrenal fatigue. Anybody heard of adrenal fatigue? Well, what happens is your adrenals are so tired because they're constantly having to, jump into gear and secrete this cortisol. So you want to get good sleep, and that's where that sleep trim is going to come into play. We also have a product called Metabolic One. All right. If you're type 2, you can imagine this is going to help. It's going to help decrease your appetite. It's going to speed up metabolism. I want to talk about a couple of their ingredients. It has an ingredient called bitter orange. Bitter orange is an herb that is shown to lower blood glucose levels. It also has a product called an herb called rhodiola. Rhodiola is also an adaptogen. Remember how we talked about adaptogens can up or down regulate hormones in the body. So rhodiola specifically is going to help lower cortisol levels. So if you are like on the verge, if you've got metabolic syndrome and you've got a lot of belly fat, man, you're producing a lot of cortisol, you need the herb rhodiola. Our Metabolic One has that. It's got some other herbs that will speed up metabolism, but it also has something called chromium. Everybody remember from chemistry in high school, the periodic table? Chromium is an element, and chromium actually makes insulin a better transporter. So chromium is going to work with insulin to absorb more glucose. And so our Metabolic One has all of those things in it. And here's the other thing. Even if you're type 1 and you don't need to lose weight, see, type 1 diabetics tend to be pretty skinny. Even if you're type 1, you still need Metabolic One. Because of everything I just told you, because your insulin is directly related to all these other cascade biochemical mechanisms. They're all connected. And so Metabolic One is great. We also have something called green coffee bean extract. And guys, that I could go on and on about that in and of itself. I don't want to take up too much of your time, but you should literally Google green coffee bean. You will be blown away. We also have a product. This is in our GPS line called Adapt. Adapt, just like our Goyen, is full of adaptogenic herbs, and you can take this at bedtime. So a lot of people, we have this workout line, it's called GPS, and they're all going to be in this like blue and green. And people look at that and they think, oh, well, if I'm not going to work out, I don't need that. Guys, like, I love the GPS line. Everyone should be on, if you're over 50, you need to be on the GPS line. You know why? For a lot of reasons, but as we naturally age, we begin to lose muscle mass. This stuff is muscle sparing. It has branched chain amino acids. It's going to help lubricate your joints. It's going to help repair muscle, tendon, and ligament. There are so many things the GPS line does. We also have a product called Circulate. Again, remember how we talked about in diabetics, diabetic neuropathy, the circulation is going to go down. You need to be on Circulate. You need to be on Circulate. The other thing, diabetes. Often men are going to suffer from some form of erectile dysfunction. That's just, ED and diabetes go hand in hand. Circulate, guess what? It's got proarginine. That's a vasodilator. Guys, it's your natural Viagra. You're going to love it. I'm being serious. So Circulate, everybody should be on that. I think that's all. Let me check my notes super quick and make sure. Yeah, I think that's it, guys. So I hope that helps explain insulin's role, the difference between type 1 and type 2. Type 2 is reversible, type 1 is not. And yes, Tom, thank you for that comment. You made me smile. The answer is yes, I do. All right, guys, thank y'all. Have a great rest of the night. And check out our testimonies. And if you have any questions, please, please, please get with the person that invited you to this group. We have a wealth of information. There are tremendous leaders on here. And like I said, we've got a detox group that you guys really need to check out. It's tremendous for a metabolic reset. And remember, hormones supersede diet. You need to start with your hormones, getting those regulated, then go to diet. All right, thanks. Have a great night.